Can you erase wrinkles, tighten skin, and get a mini facelift from the consistent use of at-home tightening and lifting devices? Before you go spending thousands of dollars on every new miracle device that's trending, let me educate you about the science and technology behind many of these devices, how they work, if they work, and which ones are worth your time, money, and investment, and the potential negative side effects that no one else wants to talk about. I'm Dr. Stephanie Kappel, and I'm a board-certified dermatologist and fellowship-trained cosmetic dermatologist. I make these videos to provide a free resource of unsponsored, non-biased, and science-based educational content to beautify your skin at every age and to truly age in reverse. Today's video is part 2 in a 2-part video series where I'll be talking about at-home lifting and tightening and anti-wrinkle devices. If you missed last week's video, which is part 1, we talked about at-home LED masks, at-home laser, and hair removal devices, so be sure to watch that video if you missed it. So what is microcurrent? You'll see microcurrent in a lot of at-home devices, including Nuface. And the way microcurrent works is it sends electrical impulses and currents through the skin and subcutaneous tissue to lift, tighten, and pull to help define the jawline, lift the brow, minimize the appearance of fine lines and wrinkles, and to tighten the skin. The mechanism of action in which it works is just that, sending electrical impulses that causes muscular contraction. Not really contraction of the keratinocytes or skin cells because they don't have that capability, but by contracting those thin muscles underneath the skin, it can lead to lifting, tightening, and smoothing out fine lines and wrinkles. Now, the caveat with microcurrent technology is it doesn't last. It is reversible. So it's something that you have to repeatedly do over and over again to sustain results. And the way in which it works is by stimulating muscle contraction through electrical stimulation, so there's no real stimulation of collagen or effect on the actual skin cells itself. There's no effect on the epidermis, the papillary dermis, or the reticular dermis, but rather muscular contraction from underneath, which can do a great job of lifting, tightening, pulling, and smoothing the skin. Now, some people will say that the microcurrent technology has been shown to stimulate collagen synthesis from the fibroblasts. Fibroblasts are the collagen-producing cells in our skin, which can also plump and smooth fine lines and wrinkles. However, there have been no statistically significant studies backing up this statement, so it's not safe to say that there is any collagen stimulation from the Nuface or any equivalent microcurrent device. However, you will get results from the lifting, tightening, pulling, and smoothing out of fine lines and wrinkles through the electrical current stimulating myocytes or muscle cells, which is only temporary. So the company will say that it lasts 1 to 3 days. Not having this device myself, but talking to patients day in and day out who use the device, most people say that it lasts about 24 hours. And it takes about 15 minutes a day to do this procedure every 24 hours to sustain results. Does it work? I think it does. Does it last? It does not. So it depends on how much time you're willing to put into a daily routine. Now, for some people, if they have a big event or they have a meeting with their friends or they're going to a wedding and they want to put in the time to lift, tighten, and pull, contour the face, I think it's a worthwhile investment. But for long-term results, I don't feel that it may be for someone who wants more long-term results that may last months and even years, especially when they're dedicating that much time day in and day out to performing this procedure on themselves. Would I recommend Nuface or any microcurrent device? I think for the right patient candidate, it might be useful. My channel is non-sponsored. I'm not an affiliate with any companies at all, so I could speak freely about this device. And I will say that patients who use it, I have half of the people that say that they really like it and they enjoy the results and they don't mind dedicating 15 minutes a day every 24 hours to maintain results. But I have other groups of patients who are more into long-term sustainable, real active changes that happen in the skin that are long-lasting. So instead of spending 15 minutes a day, which over the course of a year adds up to be 91 hours a year, your time may be better spent just going into the office and having a fractionated laser resurfacing treatment, which will give you results that will last for over a year, decrease your risk of skin cancer, actually induce changes, histological changes that you can appreciate by looking at the skin under the microscope with increased collagen stores, increased elastin stores, and smoothing of fine lines and wrinkles. But this may not be for everyone. So knowing what you're getting into, if you know that it's going to take up time, if you know that the results will be reproducible and hopefully satisfactory, and you're not worried about wasting time doing this every single day, then this may be a great option for you. Also, just keep in mind that the microcurrent devices are contraindicated in people with any seizure or epilepsy disorder, any cardiac defibrillators or implantable pacemakers, any cardiac issues, and those who are pregnant or may become pregnant. So would I recommend a microcurrent device? Probably. Would I say it's as good as coming to the office and having an energy-based device treatment that's going to last 5 to 6 years and actually stimulate collagen to produce real changes, not temporary changes? Probably not. So it just depends. But I think knowledge is power, and making an informed decision on what you're going to spend your time and money on is really, really important. And that's the purpose of this video today. So what is ultrasound or microfocus ultrasound, and how can it be used for skin tightening in at-home devices? Now, energy in the form of ultrasound, which is sonic energy, gets put into the skin to distribute heat. Heat stimulates the fibroblasts, which are the collagen producing cells in our skin, to make collagen and make elastin. Those are extracellular matrix proteins. Those are the proteins in our skin that give skin that smooth, tight, bouncy contour. Those are the proteins in our skin that we start to lose as we gain wisdom and have birthdays. So to stimulate the fibroblasts, to upregulate those cells to produce more collagen, heat in the form of ultrasound, whether it's an at-home device or an in-office device like SoftWave, Ulthera, Ultherapy, will induce the fibroblasts to make collagen. So it's just a skin tightening device. Now, usually these devices are limited by the amount of heat needed to penetrate through the epidermis into the dermis, where it stimulates the fibroblasts to make collagen. And sometimes, when not done correctly, can cause a thermal burn, it can cause nerve damage, it can actually demyelinate the fat that surrounds the nerves, that can have nerve impedance or nerve palsies or problems. So it can be very, very tricky. So to use ultrasound in an at-home device, you have to be very careful. And if a device is used at home, then it can't be strong enough to really induce really dramatic changes, because it would also put the consumer at risk to having the deleterious outcomes or side effects when it is not done correctly, like nerve demyelination, pain, thermal burn, and so forth. But ultrasound, just like other energy forms like radio waves or radio frequency or microwaves, all of these forms of energy can be used to put heat into the skin, because skin responds to heat with a controlled wound healing environment. And whenever you hear the words wound healing environment, that means upregulation of collagen, because scars are full of collagen. And so you have to be careful, because you want to induce these changes. You're basically inducing a very controlled wound healing environment for the benefit of the lifting, pulling, and firming of the skin. But you have to be very careful, and you have to be very dose dependent with regard to how you're applying this to your skin, because although it can tighten the skin, sometimes the amount of energy needed to achieve collagen stimulation when you're using it transdermally, going through the epidermis on top of the skin, it can induce other changes. So you have to be very careful. Hyperpigmentation, nerve damage, and thermal burn. So do I recommend Ultherapy or ultrasound as a heat energy source to stimulate collagen? It's not my favorite. I think radio frequency is a lot more effective and a lot safer, but for at-home devices, many of them do incorporate ultrasound as a mechanism of heat activation of the fibroblast. And so that's why I wanted to discuss it in this video today. So what is thermal activation? You'll see that word thrown out all over on social media. Thermal activation is just heat from any energy source, as we talked about before, ultrasound, radio frequency, even microwave technology, any heat source that is going to heat up the skin into the temperature range window, which is going to stimulate collagen synthesis. And we use that collagen synthesis pathway to benefit from it, to smooth out fine lines and wrinkles, to smooth out laxity, to firm the skin, to lift the skin, and so forth. But the problem with thermal activation is that in order for a device to achieve thermal activation, to get to collagen stimulation territory, you have to pass through the epidermis, which is the uppermost portion of the skin. So if you have a transcutaneous, mean on top of the skin, handpiece of a device, like an at-home device, it has to go through the epidermis, and it has to get down here, and it has to be within a certain temperature range to stimulate collagen. The problem with a lot of at-home devices is the amount of energy or heat that would be needed to stimulate and get this area of the skin, which we call the subcutaneous or the hypodermis or the dermis, into a collagen stimulating window. We would be achieving energy levels and heat temperatures that are way too hot for the epidermis and can cause the melanocytes to overproduce melanin in response to the heat, meaning you're going to get brown spots, melasma, and hyperpigmentation, especially in people who are Fitzpatrick skin types 3 through 6 or darker skin tones or olive skin tones. So you have to be really careful, because in order to have thermal activation, energy to stimulate collagen to smooth, tighten, and pull the skin, you may be causing hyperpigmentation or a thermal burn on the outside of your skin. And if it's not causing that, then the energy may not be sufficient enough to stimulate collagen within the skin. So the technology in in-office procedures like thermage, The thermage tip has a cooling plate that's underneath it that cools the epidermis, and the arc of radio frequency that goes from one pole to the other on the transducer handpiece gets right into the dermis where it needs to be at the targeted specific point, and it gets into a certain temperature range to stimulate collagen very elegantly. The problem is when people turn it up and they go up too high, or they are using anesthesia or some type of topical numbing cream where there's no biofeedback from the patient to say, hey, you're heat stacking, that's hurting me too much, because you're going over the same area over and over and over again. It's easy to have fat loss and thinning of the fat atrophy, or subcutaneous tissues, which can make you actually look worse in the end. So it's really important when using at-home devices to just be aware of that and kind of understanding how these work. You want to get the transcutaneous energy to stimulate collagen, but you don't want to hyperpigment the skin, you don't want to burn the skin, and you want it to be sufficient enough to actually induce a change. Otherwise, it's a complete waste of money and your time. Okay, so at-home radiofrequency versus in-office radiofrequency devices. As we just talked about before, these are all achieving thermal activation to stimulate collagen synthesis. And collagen is what keeps our skin nice and firm, smooth and tight, and wrinkle-free. But the in-office procedures are more strong, they're more powerful, and they're more regulated, and they're more elegant, especially when you have a provider who understands the physics and the physiologic response of the skin to these energy-based devices. And when you don't have that, or when it's FDA cleared or FDA approved to be used at home, it can't be strong enough to actually induce thermal activation and stimulate collagen, because if it was, it wouldn't be safe to use at home to a consumer that doesn't know how to heat stack, how to stack the vectors, how to keep that temperature within a certain range, because the range of temperature that is needed to stimulate collagen synthesis is actually below the range that is needed to melt fat. And unfortunately, that's what we see happen when people are just cranking these devices up, or when they're doing too many passes, or when they're not using them appropriately. So the difference between an at-home device and an in-office device is in-office is much stronger, because if it was strong enough to be used at home, people could actually hurt themselves. And then it's also just more elegant and specific, but it could be more expensive, and it may not be available to everyone. So at-home devices may be an option for someone who doesn't want to spend the money or the time to go into the office and prefers to treat themselves at home. But the two biggest contraindications or side effects is you're going to hyperpigment, not get the results you want, or waste your time and money. However, if you happen to use this device and have great results, maybe you're a candidate for it, maybe you talk to someone else who used it, it may be worth looking into. So I have an unbiased view, but just want to give you all the information before you decide if an at-home radiofrequency device would be best for you. Okay guys, so it is 6 a.m. Just getting my kids up for school. I'm making them breakfast. I'm actually making chicken and rice right now so that they can have a hot meal at school. Made with love from mom. So let's get into the science behind what happens in the skin as we age and what these devices can do to help negate that or turn back the hands of time. So basically, as we lose extracellular matrix proteins like collagen, elastin, the glycosaminoglycans, the substances in the dermis of the skin that give skin that turgor and that structural support, we lose that as we gain wisdom and have birthdays and get older. So things that are going to stimulate collagen are going to reverse those changes. So at-home devices that claim to stimulate collagen and claim to restore those extracellular matrix proteins from thermal activation of the fibroblast cells in the skin. The Nuface device, like microcurrent devices, for example, will not induce collagen synthesis. There are some claims that state that it does, but there hasn't been any data or supportive studies demonstrating that it does. And by contracting muscles in the face and neck and other areas will help through microcurrent stimulate muscular contraction to help tighten, but the mechanism of action isn't tightening through the same mechanism that's happening that's causing the aging. Meaning loss of collagen will cause skin laxity, fine lines, wrinkles, and skin sagging. There's also muscle laxity, relaxation of like the ligaments and tendons that hold up our skin, and the microcurrent device is going to help mitigate that or negate that by stimulating muscle contraction, but it's not a full picture. It's not correcting the collagen loss or or the elasticity loss and loss of elastin fibers. So the science path is different than the correction path. So it's not truly going to give you long-lasting results, and that's why. Another question that we often get is, do these at-home devices affect Botox and filler? So if you have Botox, the neuromodulator takes effect in the snap-snare complex of the muscles in the pre- and post-synaptic membrane. And in English, what that means is it basically inhibits muscular contraction. It takes about an hour, depending on the neuromodulator, how it's reconstituted, to take effect. Once your Botox is kicked in, you don't really have to worry about it expiring faster unless you have a faster metabolism, or say you're like me and you work out 5 days a week, you'll probably burn through your Botox a little bit faster. But the microcurrent devices, because you're stimulating muscle contractions or contracting, the more you're going to burn through your Botox faster. It's not a problem. I have a lot of patients who I see regularly for Botox who use the microcurrent device, and it's fine. It's just it's going to make you go through your Botox a little bit faster, because the Botox or any neuromodulator is going to affect the snap-snare complex in the muscle pre- and post-synaptic membrane to limit contraction of the muscles, which helps smooth, for example, crow's feet, forehead lines, sharpen the jawline, so forth. So if you're using a microcurrent device that's going to stimulate muscular contraction, you're going to probably burn through your Botox faster, and instead of lasting 3 to 6 months, it may last 2 to 4 months. But that's not to say you can't use them together. I have a lot of patients, again, who use microcurrent devices who I see regularly for Botox, and they're happy. Filler won't be affected by the at-home devices or the microcurrent device. When you inject filler in the dermal plane, it's down here, and the energy or microcurrent from the devices is way up here. So they're not even in the same tissue plane. So you don't have to worry about filler being moved or destroyed or metabolized through at-home devices. Now, if an at-home device is penetrating very deep, or, it's acquiring a thermal energy or thermal heat that's substantial enough to where it can melt fat or address or affect the lower underlying tissues, then maybe it could affect filler, but it all just depends on where your injector put the filler. But usually an astute clinician will put the filler in a certain dermal plane that's not even in the same dermal plane as the depth of the energy that's these at-home devices are reaching. So filler should not be affected by at-home devices, including Nuface or other microcurrent devices. Botox can be affected by the microcurrent device, but not so much the other LED or at-home laser devices. So would I recommend it? I would recommend an at-home device if someone is okay with the fact that the results aren't going to be long-term, that you're going to have to invest your time and money every 15 minutes every day, which ends up being over 90 hours a year, doing these treatments on yourself. I'm the type of person that was like, let's just do it, get it done, and then I don't want to have to worry about it. So people who come into the office and have a laser resurfacing treatment, or they have a laser, they have an energy-based device like Thermage, for example, will stimulate the skin cells to make collagen, to actually correct a problem that's happening, not just put a temporary Band-Aid on it, but actually correct the problem with long-lasting results. I mean, results from Thermage last about 5 to 6 years. And after the stimulus of the treatment in the office, your skin continues to respond to that stimulus for up to a year after the treatment. So your skin improves, and then your results last a long time because you're stimulating collagen, which is the problem that's occurring in the first place. For example, if you're using a Nuface device that's using microcurrent to tighten the muscles, you're going to make it look better. But the reason why the skin is wrinkled and lax is because it's lacking collagen, not because the muscles aren't contracting. So I guess it just depends on how you look at it, but I'm trying to be a non-biased advocate because I am a laser surgeon and I do use these high potency, powerful energy-based devices in my office. It's hard for me to see the benefit in something that you're using at home, but it is convenient. And if you do have the time and it's not a worry of you to like have to do this over and over again and having your results expire, then maybe it is worth it. So what do you think
about what?
About the Nuface tightening device or at-home devices?
I think it's very good, and you guys should buy it because my mom does everything.
But I'm not telling them to buy it or not buy it. I'm just trying to give them information to decide on whether it's a good choice for them or not.
It is a good choice.
It could be a good choice for guys. Just depends. Knowledge is power. You can make an informed decision on which one you want to buy, if you want to buy it. Okay, guys, I'm actually in clinic right now. In between patients, I had a little break, so I wanted to come in here and talk about 2 lasers you guys ask me about all the time, and that's the LYMA laser and the NIRA laser. So the thing is, the problem with at-home devices is they promise you the world. They'll say that these devices will stimulate collagen, will help with fine lines, wrinkles, even brown spots. And if you haven't watched my last week's video where I talked about at-home and IPL devices science, please refer to that because I go into the science of how collagen stimulating devices can actually cause hyperpigmentation, especially in darker skin tones. So really be careful with that. Also, if you go to these websites, they'll say things like award-winning and dermatologist approved and clinical studies backing up data and scientific data, and they'll show before and afters. But there's no regulation in this industry to have any accountability for the sound clinical data and statistical significance of the data that they're presenting in these clinical trials, which are often funded by the manufacturer. So it's really hard to see. And as a consumer, some of these clinical studies look very scientific and look very convincing. But when you know the behind the scenes and the marketing ploys that a lot of these companies make and the amount of money they have to put together these clinical studies for marketing purposes, it's just is really disheartening because a lot of people will spend their hard-earned money on these types of lasers and be very disappointed, and when they try to return the device or want their money back or try to speak to customer service, they get the runaround, and I see it happen to my patients day in and day out. So I just want you to be aware of that. This is a pico laser. This is a true laser, and this device costs about $300,000. In a dermatology or medical office, you really want to make sure you have high-performing lasers, and those come at a price. But when you break down the cost of an in-office laser procedure with the amount of money that you will spend on an at-home device like the LYMA laser or the NIRA laser, and then how much you have to spend to reverse a complication should it happen, it ends up being more expensive than having an in-office procedure, which is going to do more for your skin in the long run anyway. So it's hard for me to recommend the at-home lasers. The Nuface and the microcurrent device, they can't hurt you. They may hurt your pocketbook and hurt your time, but I don't feel that they're going to do any harm. Is it going to give you these amazing results that are going to last years and years? No, but that's the downside of it. I think the downside of the laser and the NIRA laser is that you can spend your hard-earned money. I mean, the LYMA laser is listed at $2,695. So the treatment for one pico could be anywhere from $900 to $1,200, which is a lot less expensive, and you'll get a lot more out of it. It's just good to make an informed decision. My channel's non-sponsored, and I don't want to say anything negative about a company. All I can do is just protect you guys from making bad decisions, and just know that if you're spending your money, that you may not get the results that they're promising with these clinical trials that may not even be real, or these awards that they're saying that they've won, but they don't list who's giving them the awards. Like, is it from the American Academy of Dermatology or the American Society for Dermatologic Surgery, or from ASLMS, the American Society for Laser Medicine and Surgery? Because in dermatology and academics, those are the true award-winning procedures and devices that dermatologists recommend. These awards that aren't even really true awards, anybody could say that they've gotten an award. My 9-year-old daughter can come home and say, "Mommy, I get you the award for the best mommy." And I'll be like, award-winning mother. So just be careful, because there's a lot of loosely thrown out terms that really don't hold any ground within the medical community. It does in marketing, and it does for the consumer, because award-winning clinical trials before and afters that look amazing are very enticing and can be very misleading. But to go through the scrutiny of a real clinical before and after that like one of these lasers has to go through to get FDA approval, it's a different level. So just be careful and don't buy into the whole award-winning clinical trials, dermatology approved, because these laser companies, these at-home laser device companies, are really good at one thing, and that's marketing and trying to make money. There may be some people out there who have great things to say about it, but just remember, people on YouTube who are doing these reviews are often getting paid, and they're paid affiliates through the company to do these reviews. I've even been approached by at-home laser device companies that offered me money to do a review on their product, but now I think I've gotten the reputation of knowing people know that I'm not sponsored, and my content is not sponsored, and it's what I truly believe is best for my patients, not because I'm getting paid by a company to promote it. But I still do get approached now and then, and I'm just astounded when people will say, "We'll write you a check for this much money, just do a review. If you could get 100 of your patients to write us a 5-star review, we'll pay you this much money." I mean, it's dirty, the things that are going on behind the scenes, and it really makes me sad. So I'm gonna stick to this, doing lasers on my beauties and seeing patients and doing what I love, and just producing this non-sponsored content for you guys so that you can make informed decisions on what devices you decide to buy and what products you decide to use. So let's talk briefly about the NIRA laser. So it's thought to warm the dermis, to stimulate collagen production by the fibroblast cells, to tighten skin and improve texture. It retails for $590, and it's supposed to be a non-fractionated, non-ablative laser. Well, fractionated devices have been the tried and true type of laser laser technology that has been shown for anti-aging potential. There's a recent Harvard study out of MGH that shows that it decreases skin cancer and precancers by 50%. There's sound clinical data in statistically significant studies that have shown the benefits in the skin. So to say that non-fractionated lasers are superior is false in the field of dermatology. The NIRA is a diode laser, which is 450 nanometers, and water is the chromophore, meaning that's what the laser beam is attracted to. Now, 450 nanometer lasers, it's not the peak absorption peak width for stimulating collagen. Usually that's 1550 nanometer wavelength lasers, 10600, which is at CO2. There's 1440, and of 1450 can be useful for collagen stimulation, but it's not the best wavelength. It does target sebaceous glands and sebocytes, which can help diminish the appearance of pores and help with acne. A NIRA may help with downregulating sebaceous gland activity, which can help with pore size and acne. But as far as stimulating collagen and having true effects in the skin for anti-aging results, I wouldn't recommend it. I just went down a rabbit hole looking at different group chats and threads on reviews and people saying NIRA was a bunch of hype. They said that a lot of YouTubers are paid online, which I agree with, to write reviews on this device. So just proceed with caution. And then the LYMA laser is $2,695. It is supported by Hailey Bieber, Sabrina Carpenter, a bunch of young influencers who also have beautiful skin without probably doing any lasers at all because they're in their 20s. So it would be maybe more meaningful or impactful to have maybe a postmenopausal woman in her 50s or 60s showing a benefit and true anti-aging effects of these devices that were not paid partnerships and were not sponsored and were not paid reviews. I think that would be more meaningful. I have not spoken with any of my patients who have used these devices with good things to say about them. There's a big market in this industry for false promises and under-delivering results, and there could be risks for using these devices. You know, even with the NIRA and the LYMA, you could have hyperpigmentation, activation of brown spots or melasma that would require you to come in the office and then spend money on like a pico laser or a different laser to try to correct those ailments. That's just something to keep in mind. So I hate to say anything negative about these devices, but I also don't want to overpromise you something that we can't deliver. The typical cost of at-home devices could be anywhere from $200 to $3,000 or even more. So it just depends on the quality and the marketing behind the device that's going to push the price point. The LYMA laser can be $2,695, which is almost $3,000, which is more expensive than an in-office laser procedure usually, which would be a lot more impactful for the skin. Other devices could be $200 depending on where you get them. Ones that are about $200 or $300 that you can find at a drugstore or CVS or Ulta or Sephora sometimes seem like they're not much money because it's $200 or $300, which could be a lot of money for some people, but the complications that they can cause will end up being more expensive in the long run and will cost you a lot more money. So the cost to reverse any potential adverse events. Now, if there's facial fat loss, the amount needed to correct that, whether it's through a biostimulatory filler like Sculptra, which is polyalactic acid, or fat transfer performed in the operating room by a plastic surgeon. I mean, Sculptra could cost anywhere from $800 to $1,000 or $2,000, depending on how many treatments you need, how many vials are needed to correct for fat loss. In-office procedures by some plastic surgeons, especially some of the ones that are on YouTube, can be $20,000, $30,000. So very expensive if you have fat atrophy or fat loss from these at-home devices. And then like the microcurrent device with Nuface, if you think about that, the cost of spending 15 minutes a day, which is 91 hours a year. So just keep that in mind too, because it's not only your money, but it's your time as well. The cost to reverse hyperpigmentation, as I discussed in the last video, depending on the lasers or combination of lasers that are needed to treat brown spots or hyperpigmentation that can occur from at-home devices and tightening devices, or the LYMA or the NIRA, could be anywhere from $2,000, $3,000, even $5,000 with multiple treatments needed with the downtime and other things that you have to consider when having a laser treatment, like skipping work, skipping your workouts, which can be impactful on one's life. So it can be quite expensive to reverse the complications, a lot more expensive than the actual device cost you in the first place. So NIRA, which is my skincare line that I formulated and engineered myself for my patients and my loved ones, using these skincare actives that are going to have a cellular effect in the skin, would be a better option than an at-home tightening device. And it doesn't have to be my line, but for example, any engineered and really technologically advanced skincare products that is going to deliver the active ingredients to stimulate the skin cells to act and behave younger, making collagen, making elastin, increasing cellular renewal, all these things that these at-home devices do without the risk of hyperpigmentation, without the risk of not working, and without the risk of wasting your money and your time, I think would be a good option. The neck tight serum, for example, for the neck and décolleté, has topical argireline in it. It also has active ingredients and vehicle delivery systems that are going to get into that delicate thin skin to help stimulate collagen synthesis, elastin synthesis, and a lot of these active ingredients can help have the same effect that neuromodulators do on the skin. So it's like Botox in a bottle. Topical arginine in the neck tight serum is a much better investment than using an at-home device that may not even be working and may hyperpigment you and be a lot more expensive. Also using the RXR retinol, which packs a punch with efficacy without the risk of it, again, not working, being a waste of money, or causing hyperpigmentation or fat atrophy or fat loss, will be a much better investment. Of course, I'm a proponent of NIRA because I know what's in it and I know the quality of the products because I formulated them myself, but any skincare line that's medical grade that you know and trust and have seen results after using the products would be a better investment probably than an at-home device in the end. Okay guys, next week's video is one that I'm super excited about and a topic that you've all been asking for. Next week we're going to be talking about PDO threads, everything PDO threads, including thread lifts, and a new technique that was just developed that gives incredible results, better than any other technique that I've seen before. We're going to be talking about PDO thread lifts as an alternative to facelift, the truth about thread lifts, and what is possible with this treatment option. We'll also discuss the misinformation and controversy surrounding PDO threads. So be sure to subscribe and hit the notification bell because you don't want to miss this one. If you missed last week's video, be sure to watch it because we took a deep dive into the science behind LED at-home light masks and at-home laser devices as well. I love making videos for you and I love you guys. As always, we'll see you next week.